and welcome to HealthRIGHT 360 and its associated programs. Our organization is dedicated to helping you in your road to recovery while protecting your health and safety. As COVID-19 continues to affect communities around the world, it is important that we all do our part to reduce the spread of the virus. In this video, we will be discussing what COVID-19 is, policies in place at our organization to prevent the spread of COVID-19, and some simple yet effective actions which you can take to prevent the spread of COVID-19. What is COVID-19? COVID-19 is a highly contagious respiratory illness caused by the SARS-CoV-2 virus. COVID-19 spreads through respiratory droplets that are released into the air when an infected person speaks, coughs, or sneezes. These droplets can then be inhaled by other people, or they can land on surfaces and objects where they can remain viable for several days. The virus can also be spread by a person touching a surface or object that has the virus on it and then touching their face. The symptoms of COVID-19 can range from mild to severe. Some people may not have any symptoms at all, while others may experience fever, cough, shortness of breath, fatigue, body aches, and loss of taste or smell. In severe cases, COVID-19 can lead to hospitalization and even death. To help prevent and limit COVID-19 transmission, we screen all incoming new patients and any current patients with new onset of respiratory symptoms with a COVID-19 rapid antigen test. Rapid COVID-19 testing, also known as antigen testing, is a type of diagnostic test that can quickly detect the presence of the virus that causes COVID-19. These tests typically provide results within 10 to 15 minutes. To perform the test, a sample will be collected from your nose with a swab and placed into a testing solution. The sample is then processed to detect specific proteins from the virus. The results are read visually using the test strip that comes with the rapid testing kit. You will be notified of the testing result by the staff performing the rapid testing. Anyone who tests positive will be asked to quarantine in isolation room for 5 days to help prevent COVID-19 transmission within our facility. In the rare case of ongoing COVID-19 spread within the facility, all participants of the program will be asked to participate in a repeated scheduled COVID-19 rapid antigen test, regardless of symptoms. These additional measures are enforced to ensure the safety of everyone in the program. Your cooperation to these additional COVID-19 testing policies is a requirement to stay within our program. We understand the additional inconvenience that these measures may cause, and we appreciate your cooperation. In addition to organization-wide COVID-19 screening policies, we also want to offer actions that you can take to help minimize COVID-19 complications and prevent severe disease. Wearing a mask is one of the most effective ways to prevent the spread of COVID-19. Masks help reduce respiratory droplets released into the air when we speak, cough, or sneeze. When these droplets come into contact with other people, they can transmit the virus. By wearing a mask, you are helping to protect others from potentially being exposed to the virus. Washing your hands frequently with soap and water is another important prevention measure. The virus can be transmitted through contact with surfaces and objects that have been contaminated with the virus. By washing your hands frequently, you can reduce the risk of becoming infected. You can also use instant hand sanitizer dispensers around the facility to sanitize your hands and prevent transmission. Although facilities are part of HealthRIGHT 360 do not mandate vaccination for patients, we strongly encourage everyone to be fully vaccinated against COVID-19. To be fully vaccinated, a person needs to receive at least 2 doses of mRNA vaccine with a strong recommendation to receive a 3rd booster dose. Vaccines are highly effective at preventing severe illness and death from COVID-19. People who are vaccinated are less likely to require hospitalization or die from the virus. Vaccines are especially important for people who are at higher risk of severe illness from COVID-19, such as older adults, people with underlying health conditions, and pregnant patients. If you would like to be vaccinated, please inquire with the medical staff. Vaccinations are free of charge, and necessary transportation can be arranged so that you can receive your vaccination at the nearest pharmacy or clinic. In conclusion, participating in rapid testing offered by the facility, wearing a mask, washing your hands frequently, and being vaccinated are all effective ways to prevent the spread of COVID-19. By following these simple precautions, we can all do our part to keep ourselves and others safe during this pandemic. We also want to extend a warm welcome to everyone participating in one of HealthRIGHT 360 programs. We are invested in your success in recovery. Please don't hesitate to reach out to our staff if there are any additional questions or concerns. Thank you for your time.